Hi, everybody. I hope everybody's doing well. I'm trying to do well. I came across some more information. Actually, what that means is a friend gave me some information, and so I have to say thank you to my friend. Um, Thank you. I wanted to get into this right away. Basically, what we're going to go over here right now is what exactly is happening to the patients in layman's terms. Why are patients being intubated and put on ventilators? That's a very problematic thing. What is the difference between ventilators and respirators? And that is Jack, not Bast. Anyway, why was the article that disclosed a lot of this information pulled from the net? Why was it pulled down? Anyway, so we're going to go over these things real quick. This is an article that was pulled off the net, and we had to get it from the Wayback Machine when it was posted originally on the 5th of April, which was 4 days ago. So here we go. COVID-19 has us all fooled, but now we might have finally found its secret. In the last 3 to 5 days, a mountain of anecdotal evidence has come out of New York City, Italy, Spain, and etc. about COVID-19 and the characteristics of patients who get seriously ill. It's not only piling up, but now it is also leading to a general field level consensus backed up by a few previously little known studies that we've had it wrong all this time. Well, a few had some things eerily correct, Trump, especially with the HCQ, that stuff. You know, that stuff, that. Anyway, with the azithromycin, but we'll get to that in a minute. There's no pneumonia or ARDS, at least not the ARDS with established treatment protocols and procedures that we're familiar with. Ventilators are not only the wrong solution, but high pressure intubation can actually wind up causing more damage than without, not to mention complications from tracheal scarring and ulcers given during the intubation, often required. They may still have use in the immediate future for patients who are too far to bring back with this newfound knowledge, but moving forward, a new treatment protocol needs to be established so we stop treating patients for the wrong disease. And as a sub-paragraph, the past 48 hours or so have seen a huge revelation. COVID-19 causes prolonged and progressive hypoxia, that's starving your body of oxygen, by binding to the hemoglobin in your red blood cells. People are simply desaturating or losing O2 in their blood, and that's what eventually leads to the organ failures that kill them. Not many form of ARDS or pneumonia. All the damage to the lungs that you see in the CT scans are from the release of oxidative iron from the hemes. This overwhelms the natural defense against pulmonary oxidative stress that causes the nice, always bilateral ground glass opacity in the lungs. You know, those x-rays they keep on showing and it looks like fiberglass in there, you know, that kind of thing. The patients returning for rehospitalization days or weeks after recovering, suffering from apparent delayed post-hypoxic leukoencephalopathy. Strengthened notion COVID-19 patients are suffering from hypoxia despite no signs of respiratory tire out or fatigue. Here's a breakdown of the whole process, including some ELI5 level cliff notes. Much has been simplified just to keep it digestible and layman terms friendly. Your red blood cells carry oxygen from your lungs to all your organs and the rest of your body. We all know that. Red blood cells can do this thanks to hemoglobin, which is protein consisting of 4 hemes. Hemes have a special kind of iron ion, which is normally quite toxic in its free form, locked away in its center with a porphyrin acting as a container. In this way, the iron ion can be caged and carried around safely by the hemoglobin, but used to bind oxygen when it gets to your lungs. When the red blood cells get to the alveoli, or the little sacs in your lungs where the gas exchange happens, and excuse my cats, they're freaking. When that gas exchange happens, that special little iron flip that little iron ion can flip between Fe2 and Fe3 states with electron exchange and bond to some oxygen. Then it goes off its merry way to deliver O2 elsewhere. Here's where the COVID-19 comes in. Its glycoproteins bond to the heme, and in so doing, that special toxic oxidative iron ion is disassociated or released. It is basically let out of the cage and now freely roaming around on its own. This is bad for two reasons. One, without the iron ion, the hemoglobin can no longer bind to the oxygen. Once all the hemoglobin is impaired, the red blood cell is essentially turned into a Freightliner truck cab with no trailer and no ability to store its cargo. It is useless and it's just running around with COVID-19 virus attached to its purpurine. All these useless trucks running around not delivering oxygen is what starts to lead to the desaturation or watching the patient's SPO2 levels drop. It is incorrect to assume traditional ARDS, and in so doing, you're treating the wrong disease. Think of it a lot like carbon monoxide poisoning, in which CO is bound to the hemoglobin, making it unable to carry oxygen. In those cases, ventilators aren't treating the root cause. The patient's lungs aren't tiring out. They're pumping just fine. The red blood cells just can't carry the O2. The end of story. Only in this case, unlike CO poisoning, in which eventually the CO can break off, the affected hemoglobin is permanently stripped of its ability to carry O2 because it has lost its iron ion. The body compensates for this lack of O2 carrying capacity and deliveries by having your kidneys release hormones like your erythropoietin, which tells your bone marrow factories to ramp up production and on the new red blood cells with freshly made and fully functioning hemoglobin. This is the reason why you find elevated hemoglobin and decreased blood oxygen saturation as one of the three primary indicators of whether this stuff is about to hit the fan for a particular patient or not. That little iron ion, along with millions of its friends released from another hemes, are now floating through your blood freely. As mentioned before, this type of iron ion is highly reactive and causes oxidative damage. Turns out this happens to a limited extent naturally in our bodies, and we have cleanup and defense mechanisms to keep the plant balance. The lungs, in particular, have three primary defenses to maintain iron homeostasis, two of which are in the alveoli, those little sacs in your lungs we talked about earlier. The first two are little macrophages that roam around and scavenge up any free radical like this oxidative iron. The second is a lining on the walls called epithelial surface, which has a thin layer of fluid packed with high levels of antioxidant molecules, things like ascorbic acid, aka vitamin C, among others. Well, this is usually good enough for naturally occurring rogue iron ions, but with COVID-19 running rampant, your body is now basically like a progressive state letting out all the prisoners out of the prisons. It's just too much iron and it begins to overwhelm your lungs, or the lungs countermeasures, and thus begins the process of pulmonary oxidative stress. This leads to damage and inflammation, which leads to all that nasty stuff and damage you see in CT scans of COVID-19 patient lungs. Ever notice how it's always bilateral? That means it's on both lungs, bilateral. Both lungs at the same time. Pneumonia doesn't do that. It rarely ever does that. But COVID-19 does every time. Okay. I'm not able to look at the chat room while I'm going through this, so I'm just letting everybody know. I'm just going to continue on, okay? Once your body is now running out of control with all your oxygen trucks running around without freight and the tons of this toxic form of iron ions floating around in your bloodstream, other defenses start to kick in. While your lungs are busy with all this oxidative stress they can't handle and your organs are being starved of O2 or oxygen without the constant stream of deliveries from red blood cells, hemoglobin, and your liver is attempting to do its best to remove the iron and store it in the iron vault, only it's getting overwhelmed too. It's starved of oxygen and fighting a losing battle from all your hemoglobin, letting its iron free, and starts crying out, "Help, I'm taking damage," and by releasing an enzyme called alanine aminotransferase, ALT. There's your second of three primary indicators of where the stuff is about to hit the fan for a particular patient or not, okay? So all this is starting to sound familiar, right? This is starting to make sense now. All these news reports that you're hearing, and anybody who's looked into the medical part of the news reports of what's going on, this is now beginning to make sense. You could probably see it in picture form, what's going on in the body. Moving on. Eventually, if the patient's immune system doesn't fight off the virus in time before the blood oxygen saturation drops too low, ventilator or no ventilator, organs start to shut down. No fuel, no work. The only way to even try to keep them going is maximum oxygen. Even a hyperbaric chamber, if one is available, on 100% oxygen at multiple atmospheres of pressure, just to give what's left of their functioning hemoglobin a chance to carry enough O2 to the organs and keep them alive. Yeah, we don't have nearly enough of those chambers, so some fresh red blood cells with normal hemoglobin in the form of transfusion will have to do. Now we understand why they're begging for blood. Remember we were talking about that? They were begging for blood, and a lot of folks were speculating that it was because maybe those new blood donations would have the antibodies in there, or even worse speculation was that they were begging for blood so that they can get more adrenochrome. But now I'm starting to see why they're begging for blood, because these people have that ion, or the iron ion, going ballistic, and they need fresh blood with hemoglobin to get the reparations done to the organs so that they can live again and get the oxygenation out there. Okay, so the core point being treating patients with ions stripped from their hemoglobin, rendering it abnormally non-functional with ventilator intubation is futile unless you're just hoping the patient's immune system will work its magic in time. Okay, we know better than that. The root of the illness needs to be addressed. Best case scenario is to treat the regimen early before symptoms progress too far. HCQ, more on that in a minute, with azithromycin has shown fantastic, albeit critics keep mentioning anecdotal to describe the mountain promise, and I'll explain why it does so well next. This is what the writer said. But forget straight up plasma with antibodies that might work early, but if the patient is too far gone, they'll need more. They'll need all the blood, antibodies, and red blood cells. No help in sending over a detachment of ammunition to a soldier already unconscious and bleeding out on the battlefield. You need to send that ammo along with some hemoglobin stimulant magic so that he can wake up and fire those shots at the enemy. All right, that was a little off the path as far as artistic license. So the story with the hydroxychloroquine, if I said it right, yay. If I didn't, I'm dealing with it. All that hilariously misguided and counterproductive criticism the media piled on the chloroquine purely for political reasons as a viable treatment will now go down as the biggest fake news blunder to rule them all. The media actively engaged in their activism to fight bad orange man at the cost of thousands of lives. Shame on them. I've been saying a lot worse about that mainstream media because I have been a serious proponent of anything that's going to work to get these people healed. And if it's working on all these different people, get it to the people. And when France had that group that had a 100% recovery rate after using, I would say, yeah, let's try that. Let's get this going. Okay. The problem is the media is owned by the big pharmaceutical companies who's not going to stand to gain a lot of money if this cheaper version is going to work. We won't need vaccines. We won't need their special treatments. Okay. So how does the chloroquine work? Same way as it does for malaria. You see, malaria is this little parasite that enters the red blood cells and starts eating hemoglobin as its food source. The reason that chloroquine works for malaria is the same reason why it works for COVID-19. While not fully understood, it is suspected to bind to DNA and interfere with the ability to work magic on hemoglobin. The same mechanism that stops malaria from getting its hands on hemoglobin and gobbling it up seems to do the same for COVID-19. Essentially, little snippets of DNA in an envelope from binding to it. On top of that, hydroxychloroquine, an advanced descendant of the regular old chloroquine, lowers the pH. Did you hear that? Lowers the pH, which can interfere with the replication of the virus. Remember, diseases don't live very well in an alkaline body? Bingo. Okay. So it lowers the pH, which can interfere with the replication of the virus. Again, with the full details are not known, the entire premise of this potentially game-changing treatment is to prevent hemoglobin from being interfered with, whether due to malaria or COVID-19. No longer can the media and armchair pseudo-physicians sit in their little ivory towers proclaiming, dirt, so stupid, malaria is bacteria. COVID-19 is virus. Antibacterial drug, no work on virus. Okay, you've heard that, right? They never got the memo that a drug doesn't need to directly act on the pathogen to be effective. Sometimes it's just enough to stop it from doing what it does to hemoglobin, regardless of the means it uses. So, anyway, enough of the rant. What's the end results here? First, the ventilator emergency needs to be re-examined. If you're putting a patient on a ventilator because they're going into a coma and need mechanical breathing to stay alive, yeah, we get it. Give them time for their immune system to pull through. Got it. But if they're conscious, alert, compliant, keep them on oxygen. Maximum if you have to. If you have to inevitably ventilate, do so at a low pressure and max oxygen. Don't tear up their lungs with max PEEP. You're doing more harm to the patient because you're treating the wrong disease. All right, I'm about to sneeze here. Hang on a second. Check this out. So think about the ventilator. It's a machine. And if you have a patient that's breathing on their own, they're able to breathe on their own, or they're trying to breathe on their own. Do I need a ventilator? No. If I was presenting issues, with breathing and stuff, it'd be congestion and, coughing and things like that. I wouldn't need a ventilator. I need oxygen. Okay. And if you're needing oxygen, you don't need some machine force filling your lungs up and puncturing, stretching out the lungs, causing micro fissures in the lung surfaces. And the intubation itself is causing exposure directly to the bloodstream. If you do have that issue with the COVID-19, you got stuff going directly to your bloodstream, and another form of violating your immune system. Okay, because now you've got an injury inside of you. That's another strike against your immune system. And it's stressful, especially if you don't need a ventilator. What people need is a respirator. And we'll get to that in a minute. So some form of treatment needs to happen to inhibit the viral growth and replication. Excuse me for just a second. I've got a very naughty cat and I got to take care of her. Hold on just a moment, please. Hi, everybody. Where's the pause button here? They won't give me a pause button. Okay, so I'll be right back. Just a second. Get out from there. What? You were not tearing my stuff up. No. Naughty girl. Okay. I'm about to kick you both out of here if you don't. Go on. Outside. Go on. Come on. Naughty girl. Go. Okay. I'm back. Sorry about that. Okay. Naughty cats. Naughty cats. And here we go. We're going to resume right now. So inhibit viral growth and replication. And here it plays the CHQ, Z-Pack plus zinc or other retroviral therapies being studied. Less virus, less hemoglobin losing its iron, less severity and damage. Therapies used for anyone with abnormal hemoglobin or malfunctioning red blood cells. Blood transfusions, whatever. I don't know the full breadth and scope because I'm not a physician, but think along these lines and treat the real disease. If you're thinking about giving them plasma with antibodies, maybe if they're already in bad shape, think again and give them blood with antibodies, or at least blood followed by plasma with antibodies. Now that we know more about how this virus works and affects our bodies, a whole range of options should open up. And then the last note is don't trust China. China is an asshole. Disclaimer, not talking about the people, just the regime. They covered this up and have caused all kinds of death and damage and carnage, both literal and economic. The ripples of this pandemic will be felt for decades. That's a fact. Now, let's look at what a respirator does, or the difference between the respirator and the ventilator. All right. During the CV break, you may have heard about hospital healthcare providers facing a shortage of respirators and ventilators, two critical tools in fighting the infection. Many of us know that both respirators and ventilators deal with breathing in some way, but may be confused about the difference between them. Are they both just face masks? We know that. We know that's not the case. Respirators and ventilators synonyms? No, they're not. No, they can't be used interchangeably. And that's what I think is confusing. I think what's happened is that, you got politicians who are not medics, they are not physicians, and they've never worked in an emergency room, and they have no idea the difference between a respirator and a ventilator. Okay. A respirator is a mask-like device, usually of gauze, worn over the mouth or nose and mouth to prevent the inhalation of noxious substances or the like. Health professionals wear respirators to filter out virus particles as they breathe in so they don't get infected with the COVID-19 while helping people and patients. The CDC specifically recommends health professionals using what are called N95 respirators. Have you been hearing everybody talking about N95 masks? They should be talking about N95 respirators. This type of respirator fits more tightly around the nose and mouth than regular masks or surgical masks. Another type of respirator is known as a PAPR, short for powered air purifying respirators, which covers the whole head and uses a blower to filter the air. Respirators are a form of PPE, which stands for personal protective equipment. I'm sure you guys heard all about the PPE discussion. Other types of PPE health professionals wear to protect them from such hazards, such as COVID-19, include goggles, gloves, and gowns. Respiration is the inhalation and exhalation of air. That was a respiration. Breathing. It means pertaining to or serving for respiration. It's as in a respiratory disease is pertaining to serving or serving respiration. The word respirator in its medical sense dates back to 1785 through 95, and it's all derived from the Latin word respirare, to breathe in, to breathe out. Okay, so that's basically what it is. A ventilator, however, is a machine that helps patients breathe. This machine pumps oxygen into the lungs and removes carbon dioxide through a tube. The insertion of the tube into a person's windpipe, trachea, is called intubation. The verb ventilate can refer to oxygenating the blood, i.e. supplying it with oxygen, or helping someone breathing using a mechanical ventilator. COVID-19 is a respiratory disease, and it can cause lung inflammation, pneumonia, which makes breathing difficulty for patients. That's why ventilators are needed to help treat some patients with the infection. It should read, those ventilators are needed to help some patients breathe, to inhale, exhale, and exchange the gases, okay? The infection should be treated with what is pumped into there, and the infection should be treated by the blood, okay? Anyway, so when you use the words, please understand what exactly you're talking about. The medical staff are using respirators. I personally think that I would rather have a respirator, a full respirator with filtered air and oxygen, rather than a ventilator, because I don't need help breathing. I'm capable of it. Okay, now if I'm going into a coma, yeah, get me on that thing, yo. If I'm going into general anesthesia for an injury that gets a major trauma injury, and I need to go under general anesthesia, yes, go ahead, ventilator. I get it. All right. But not because COVID-19 is making my chest congested. Okay. Now, there was something else that, here's a bonus for those of you who are listening. Thank you. Here's a bonus. There are ways to, when you recline and you're going to sleep at night, if you're having any kind of congestion, I recommend honey. You drink warm beverages with honey. That will make you expectorate anything in your lungs. It'll make you cough it out. Okay, that's the first thing. I'm sorry about these glasses; they're getting on my nerves. The other thing is that if you can set up your bed with a lot of pillows and towels and such, so that your body is inclined in your chest, so that your lungs can drain out. Put a bucket next to your bed and have plenty of tissues on standby or whatever have you. But incline your body so that your feet are more elevated. It's not really your feet means nothing. It's actually your torso. Make sure your torso is at an incline so that your lungs can drain out any congestion or fluids. That will be very helpful. If you start getting a fever, of course, like I said on the previous video that I did today, I'm very concerned about this thing. So do what you can for yourself. If you have to go to the hospital, make sure that you are getting oxygen. I have been crying about this oxygen thing for a long time on the radio show and on different interviews. I have been very bothered by the fact that they kept on calling for ventilators all the time, but not for oxygen tanks. Now, in hospitals, emergency rooms, and such, they do have a supply system with liquid oxygen, and that's how they supply those ventilators in the hospital. But what about all these tent city medical units that they've got? They've got tents all outside and everything. They're not hooked up to a hospital O3 system. Okay, so where's the oxygen tanks? Remember how you drive down the freeway and you see all these trucks? Oftentimes you'll see these trucks with these tanks, these really narrow green tanks with a little nozzle at the top, just a narrower portion up on top. Those were oxygen tanks. Nobody's talking about the oxygen tanks when this is what exactly is wrong with these patients that's getting hurt by this COVID-19 is they need oxygen. That's what I mean. That's where I'm going with this. Okay. The oxygen. Let me see if I got everything covered that I wanted to talk about. Let's see here. Why was that article I read to you pulled off the web? And does anybody know? I don't. There's no other mention of the same content that was in that article. So we went over the difference between ventilators and respirators, patients being intubated to put on ventilators. It is very damaging to the body. So please, let's everybody get educated so that you know what to talk to the doctor about in these emergency people. All right. And then one more question does come to mind after all this. I remember seeing all the videos of all these doctors and nurses, and they're in the hospital and they're crying because they're wearing the same mask on their face for all the patients that they've been dealing with. So they weren't wearing the same mask; they were wearing the same respirators, right? Isn't that what they were talking about? But you see these videos and they're pulling some mask off their face. What? That's not a respirator. So something's up with this, and I do still think that there's a lot of theater surrounding this whole issue. I want everybody to be on their due diligence and be careful, and don't get hoodwinked like everybody else is doing. So okay, small chat room today, but that's okay. Hello, MG, Pono, and Timazin TV. Hi, thank you very much. Let's see. Ventilators net doctors 40 grand if signed off on the COD, the COVID ID. If other doctor makes only 10,000, the bonus is offered by who? Ooh, Pono, thank you. I will have to take a look at that. Okay, what they said was ventilators net doctors 40 grand money if signed off on the on the cause of death as COVID-19. If other doctors only make $10,000, the bonus is offered by the World Health Organization. Now, on the last video I did, I said follow the money. I was not kidding. All right. I want to say thank you to everybody who has joined in here, who has been looking and watching with us and everything. If you had any questions after this video is ended, please put it in the comments, subscribe, like, and hit that notification bell for when I go live. Because here's the thing, I've been going live at whenever today, twice today, as a matter of fact, which is a record for me, 2 videos in one day. Yeah. Anyway, so I hope everybody takes care of themselves. Please know that I love you, and I want you to take care of yourself. I want everybody to come out of this healthy and happy. I want everybody to be able to go back to their lives and enjoy their lives as we are supposed to, because we are divine beings. We are divinely created. We are divinely inspired. So I love you guys. I'll talk to you later. Bye.